Hello everyone, I hope you are well. Before we start the video, I hope you subscribe to the channel. I will give you 30 tips to stop bleeding and inflammation after tooth extraction. 1. Place a clean piece of cotton on the bleeding site and apply gentle pressure for 15 to 20 minutes. 2. Use an ice pack wrapped in a cloth and place it on the cheeks to help reduce puffiness and relieve pain. 3. Avoid forceful swallowing and severe suctioning to prevent reopening of the wound. 4. Follow your dentist's directions regarding applying a compressed cloth after extraction. 5. Avoid drinking hot and cold liquids to help avoid additional bleeding. 6. Use cold or hot compresses according to medical directions to relieve pain. 7. Avoid chewing food on the side where the tooth was extracted. 8. Follow a soft, cold diet to avoid irritation of the affected area. 9. Avoid smoking to prevent mouth irritation and delay the wound healing process. 10. Avoid sucking fluid from the wound to maintain its cleanliness. 11. Stay away from spicy and irritating foods for a while. 12. Use a cold saline mouthwash to help reduce swelling and gum irritation. 13. Avoid excessive physical activity to maintain body comfort. 14. Take anti-pain medications that the doctor may prescribe. 15. Avoid extreme embarrassment to avoid increased blood pressure and bleeding. 16. Drink sufficient amounts of water to keep the body hydrated. 17. Avoid hard foods and tough meats to reduce stress on the affected area. 18. Follow your doctor's instructions about using antiseptic mouthwashes. 19. Take a break and avoid strenuous activities for a few days. 20. If abnormal bleeding continues, contact your dentist immediately. 21. Use comfort and pressure relief devices to reduce pain. 22. Avoid consuming spicy foods and drinks to avoid irritation. 23. Avoid alcohol and smoking to speed up the healing process. 24. Use pain relievers prescribed by your doctor regularly. 25. Avoid touching the affected area with unclean hands. 26. Stay away from solid foods and tough meats for a few days. 27. Follow the nutritional advice given by your doctor to promote wound healing. 28. Use stress relievers to reduce pain and discomfort. 29. Avoid strong pressure on the affected area. 30. Do not hesitate to contact your dentist if unusual pain or bleeding persists. Thank you for watching. I hope you have a nice day and good luck.